The dental hygiene process of care is a vital component to the proper and ethical course of action for all patients' oral health. The process starts with assessments. A thorough review and interview of the patient's medical history is the first step in this process. This is important to establish not only the patient's ASA classification, but also to inform the clinician of what needed measures need to be taken or avoided to provide the optimum standard of care. Vitals are taken at the beginning of the appointment to establish a baseline for the patient's current health standing. Radiographs are taken at indicated intervals depending on the severity of the periodontal disease and risk of decay to assist in diagnosing pathology, periodontal disease, and caries. After radiographs have been exposed, the patient has further assessments completed. Probing depths, recession, furcations, and mobility, among others, are measured and recorded during this phase to determine the dental hygiene diagnosis. It is vital at this point to provide patients accurate and appropriate oral home care instructions. This will help to create a working relationship between patient and clinician to create and maintain an environment of oral health. A treatment plan is then created to determine the appropriate course of action for the patient. Risk factors for both caries and periodontal disease should be assessed, and the plan for treatment should be discussed with the patient. Implementation of the plan is the next step in the process of care and involves the hygiene and restorative needs that the individual patient requires. Documentation should occur after every appointment and should include a thorough and accurate representation of patient concerns, assessments, radiographs, dental exams, and restorative needs, among others. Evaluation occurs at the next recall visit to assess healing of tissues and periodontal pockets. At the end of every completed treatment session, a treatment and referral form should be filled out and given to the patient to provide a cumulative view of what was completed at the appointment and what still needs to be done. The recall interview should also be discussed at this time.
Here's your baggie with the toothbrush and floss. Thank you.